Welcome back, everyone. You're watching We Heart Therapy, the special series EFT Talk. I'm your host, Dr. Bell, licensed marriage and family therapist and certified EFT Supervisor and Therapist here in fabulous Las Vegas, Nevada. And I'm super excited to welcome to our show today. We have Dr. Tal Padeh. She is a licensed psychologist, clinical psychologist, and an ICEFT EFT trainer, and the head of the EFT Center in Israel. So it's really exciting to have her on our channel today. And we are going to be talking with Tal today about working with two withdrawers. So if you are doing couples therapy using EFT and you have a couple come in and you have two withdrawers in your cycle. So that's what we're going to be talking about today. So thank you, Tal, so much for being with us today.
Thank you. Thank you. I love your show. I love the way that you spread EFT all around the world. And it's a great privilege for me to be a part in that.
Well, thank you. Thank you. And we're so honored to have you on our show. And, especially coming all the way from Israel, it's so incredible. So thank you so much. And okay, so let's jump right in. So how can people, first off, when we say withdrawers, can you maybe give a brief description for folks what we say when we mean that somebody is a withdrawer versus a pursuer?
Yeah, well, I think I have a nice description I just got from a friend who called me not so long ago, and she said she was suggesting a couple for a live session. And she said, these are two withdrawers, right? They are very nice to each other. They're very polite in sessions. They really love each other, but nothing happens in sessions. Actually, it's really boring with them. I've seen them for 8 sessions, she's saying, and I know they came in to get help. They want help with their sex life, but nothing happens. Maybe a live session will help them kick up something. So maybe you've had one of these couples, which you can imagine being with two withdrawers, which is not so common because who would bring them to therapy, right? You need some of this restore energy to bring the couple into therapy.
Yeah.
But you have two people that have this tension of putting down the energy of the emotion to protect themselves and their partner from escalation, from emotion. This can be actually boring, like nothing happens. So I think that's one of the descriptions, or like one of the tips you can say, okay, maybe that's what we're having here.
Yeah. So I love what you're saying is when you have two people whose strategy in the cycle around conflict and emotional intensity is to kind of slam the brakes, lower that intensity by going away in some way, withdrawing. And that's not necessarily the same as somebody who is like a burned out pursuer who used to be the one to try to pursue, try to move things towards change, and yet sort of lost hope and kind of fizzled out and is pulling away. And it's not the same as a gentle pursuer who might make an initial reach, but then maybe spook easily. That's what I kind of say is they spook easily. If it doesn't go well immediately or they don't get a good response, then they'll just sort of give up easily. So those are different. And this you're looking for when you're really trying to assess if somebody is a true withdrawer. You're looking for what happens, what's their kind of coping strategy when emotional intensity comes online. Am I getting that right?
Right. And I think for me, when a person, or for most of us, right, when a person is not attached to his emotions and not to the other person's emotions, then you feel like this distant from him. And that's a main thing to start notice that.
Mm-hmm.
And I think it is important to how you think about it, because then otherwise you might say, okay, maybe this couple, they don't really need me. Maybe they're okay. Like
Yeah, they're de-escalated because they're not
they don't
fighting,
bring
which
anything.
is not really actually the thing we're going for, right? Not fighting or not having conflict. A can also mean they're not connecting, but also that's not our goal in therapy is necessarily to prevent people from having conflict. And you know, it's not the sorry, the hamster jumped off the wheel again, my ADHD brain. But you're saying, you know, just because they don't have high intense energy doesn't necessarily mean that they don't need you. Obviously, something brought them in.
Right, right. So we do I do believe that if something brought them in, that must be really important, because
Mhm.
this is against their way. This is against their natural way. And
Mhm.
we can easily miss that, or and say maybe they're okay, maybe we've just seen them for a few sessions and they're okay, or maybe they just don't like each other and they can separate, and maybe they can do it very nicely, you know. It won't be like this
Mhm.
Rose and Rose movie. They will have a nice separation,
Mhm.
but I think if we can see behind this protection, behind this way of lowering down, and help them to start be in touch with their feelings, with their story, with to start feeling more safe to
Mhm.
bring things, then we can give them something so precious.
Mhm. Yeah, I love what you're saying. And it really brings back to my mind kind of establishing first and foremost in that move one of stage one or step one of stage one is why are you here? Right. And, so I might be getting curious about whose idea was it to come to therapy, what was happening that kind of made you guys get to this point. It's like, maybe we need to go talk to somebody. And even if we're not having conflict, clearly it feels like something's missing. I mean, something moved inside and between us that has us here. So I'm always sort of connecting back to that. Where did we start out and have we even gotten to that place yet? Where we are at the end of our therapeutic goals, right?
Right. Right. So I think in this place, I want to say two contradictory things in a way. Because in one hand, we want, just as you said, as you mentioned, we want to ask them, what brings you in? Where is the pain? Where do you need help? Is it your sex life? Is it you feel the distance? Where do you want help? And so in one hand, we want to give them control. We want to let them the take responsibility on their sessions, right? But on the other hand, if they are to withdrawals, we want to help them, because the avoidance will kick in. And that's the place we want to help them look at the avoidance and do something different. But if we will just respect their way and give them time and give them responsibility, it might take a very, very, very long time. And we're in focused therapy, right?
Mhm.
So um, I think we all have places where we avoid.
Mhm.
We all have the issues that we avoid speaking about. Yeah. And if we bring up this session, this topic, we say, we want to speak more about our relationship. We're not intimate enough. We don't have enough sex life. We want to speak about our financial ways, whatever. But then they don't bring it up. Then,
I'm going right for the block.
yeah.
Oh, interesting. You want more, but you don't reach, you don't move towards, you don't ask.
Right.
Huh. I wonder what comes up right there. What holds you back?
Right. So we want to do two things. It's like different things, because if they don't want to speak about their financial way, right? I had this couple once, and the woman told me in the beginning, in the private session, I'm coming from a very rich house, and he's coming from nothing. This is weird, the way we do around money, but I'm not going to speak about that. It
Mhm.
will end our therapy. I'm okay with that. That's not important for me.
Mhm.
Fine. I'm fine. That's an avoidant, but that's
Mhm.
she decided I avoid this topic for now, and I'm with her, right?
Yeah.
But if she would say, I want to speak up, or like a different couple, we want to speak about our sex life. We want to decide if we get married, if we're going to have kids together. We want sex to stay in this marriage, but they don't bring it up.
Mhm.
Then, then I would say, okay, you
Mhm.
said you wanted you to speak about that. Let me help you. This is your avoidance. What stops you
Mhm.
from bringing this topic up? Let's do it together.
Yeah, it sounds like kind of in both examples, even though one might be kind of honoring their desire to not speak about certain content issues. Again, in emotionally focused therapy, we're process consultants. And so we're kind of looking at the same processes that whatever it is, when there's something difficult, this is a place where communication stops, where we don't feel like we can come together and have a good conversation or bring something up. And if we would, the sense is it wouldn't go so well, things would be weird or bad, or, and so it's kind of going into that cycle. And what I love is, often when I hear people talk about having to withdrawers, like, oh man, I get stuck, I don't know like how to get something going. And I love what you said about it's how you look at it, right? Is we know what happens in secure attachment, and we know that's not happening. We also know what's happening in pursue withdrawal cycles, and that's not happening. So let's talk about what's not happening and explore why it's not happening.
Exactly. And I think we need a little bit more help in that, because even though it's not the most common thing, when it comes, it can be difficult. Like, uh, am I bringing the topic? Am I being the pursuer here, right? Or how do I work with that? So
Mhm.
I think we have to have some help with how do we deal with two people that bring this energy down. That's hard. Yeah.
Yeah. So kind of leaning in and mapping that cycle. How do we map that cycle when both people are wanting to move away from the emotion? And
Right.
again, I think, you just kind of said it perfectly, right? Is both of them are wanting to lower that intensity. So we want to make note of that. What happens when things aren't okay, right? We're talking about what isn't happening. And just because there's certain types of things that aren't happening, like conflict and high intensity, doesn't mean that nothing is happening. It's something is happening. It's they're moving away internally from the emotions, the intensity of what's happening, which keeps them avoiding from talking or bringing stuff up, reaching a variety
Yeah.
of things.
Yes.
Yeah.
And this is it's nice how you describe it, because I think it's they don't know how to describe what happens, right? So it
Mhm.
feels like nothing happens, or it's not a big deal. Like
Mhm.
this couple that wanted to talk about how they
Mhm.
can come close together and talk about their sex life, but they didn't have sex for maybe like 2 years
Mhm.
to avoidance. They were a very young couple, and we did start to speak about it, but then I send them to do an exercise and they come back and they don't mention it again, right? And then I ask, you remember I sent you to have this sensate focus exercise? How did it go? And he said, well, we didn't do it, so we will try, we'll do it to next time, right?
Mhm.
So what
So
do I
what
do
we
with
do
that?
right there. Mhm.
Yeah. So of course, the perfect answer always is we validate, right?
Mhm.
So I validate that. Of course, you don't, if you didn't do it, it makes sense. You don't want to speak about it like nothing happened. But that's the pattern. That's what happens to you. You avoid. So it makes sense. You also avoid from having this exercise. But let me help you there. Okay, let me speak to you about what happened. Why didn't it happen? Let's look at it together and see the avoidance, and let me help you there. I don't want you to be alone with that. So
Mm-hmm.
that's a part of that. And of course, I also said most of the couples don't do this exercise in the first week, right?
Mm-hmm.
That's why we give this exercise. If it was easy, you didn't have to use that. So we normalize it. We come together with them. That's great. That's the job. We speak about what didn't happen. And easily, step by step, we want to encourage them to look at why didn't it happen? What did they feel? What did they think? Did they even think about it or they didn't think about it at all? And we start building a
Mm-hmm.
story from this nothing happened.
Mm-hmm.
Mhm.
Yeah, I'm thinking about, again, like part of building that story is immediately sort of shadowing the avoidance and the validation with the goal. Like again, there's this part of you, it's the longing, right? The goal, the longing is in the goal, right? Of, oh, we want to have more sex, we want to have a better relationship. Or one of us might be saying it. Maybe again, the withdrawer's job is they've learned to get away from emotional intensity, anything that might bring about anything that can feel like failure or anything really uncomfortable. So, of course, one might be saying, oh, I'm okay with it, even though if they were totally okay with it, they probably wouldn't be in therapy, right? And one
Yeah.
part of them isn't okay with it, and they agreed to come. So it's like, how would you lean in, Tal? How would you start to build that story in that place where you have the people avoiding using that longing? Well, here's this place where
Right.
there's that desire.
Right. So I want to start asking them the questions they don't ask usually, like, what is not happening? Right? Did you think about it at all? Do you ever think about it? Are there times that you maybe thought, maybe should I suggest, and something went back? I really look for the small details and help them make it more specific. And I bring the topic back again if they don't do it. I
Mhm.
will say, you remember, this is the topic we wanted to speak about. Are you okay with that? You didn't bring it up. Why didn't you bring it up? Is it okay for you if I remind you to do it? This is our topic, right? And then, like week after they did do this exercise, of course, they had to, after we speak so much about what didn't happen. Um, but then I asked if they spoke to each other about it. How was it? So they didn't. Of course, I validate that too. Great, you did it. It's a great progress and great that you brought this topic up again. And so let's speak about it now. How was it for you? And then I want to see about even small things, right? So if I go on with this example,
Well, and
she,
immediately before we go on, I'm even imagining first and foremost, you might already be met with a common withdrawal response of I just didn't think about it, right?
Mhm.
And that gets a lot of people stuck, right?
Right.
And from a
Yeah.
process point, how would we sort of conceptualize that I didn't think about it?
Mhm.
Kind of, where does that fit in the process?
That's a good question. That's a hard one, right? I didn't even think about it. So,
Mhm.
what do you have to do with that? So,
Mhm.
like I've said before, the first good answer is we validate.
Mhm.
Of course, you didn't think about that. That's a
Mhm.
very resilient thing to do. If there
Mhm.
is something that is painful and you don't think about it, then you can keep on doing good, important things, right? That helped you a million times in your life. You can put things aside and move on and do things. That's brilliant.
Yeah.
So we validate it, we join their defenses.
Yeah.
And
And
then,
that's exactly what I was kind of honing in on is that it can be another defense, right? Where it's like, hey, we're here in therapy. We something went on that got us here in the first place. We know that we're meeting probably every week, and there's a good chance our therapist could bring it up. And our therapist gave us this assignment to do tied to our goals. And yet, as soon as I left the office, I didn't think about it, right?
Yes.
And that's often, it is a protective strategy. When something might stir up discomfort, it's easier just to sort of stick it in the back of our mind and not think about it, right? So we can move forward. And sometimes, again, when somebody's used to doing this for so long, they don't even have to, it's harder for them to even bring it back to their memory because they're so used to tucking things away that
Right.
might be uncomfortable. So it's like, yeah, I tucked it away and I didn't even have a process to recall it back to the forward because that's again my avoidance is I can tuck it away and forget about it.
Right.
And
So the
yeah.
first thing is to see the good intention and in this protection, right? This, and it is a very valuable thing. I do that a lot. I have so much stuff going on around me. And when I can just put them away and not think about them, that's the way I survive, right?
Mhm.
So we want to validate that. It's a good thing that you can do that.
Yeah.
And then
Mhm.
we want to join other places where this thing is when you want something different, when this strong thing that you're used to do is blocking you from something else that you want. I want to ask them, like, where do you want something different? Um, and then when we join them, not in
Mhm.
a judgmental way,
Right.
and in this soft voice that wants to come along and to say, hey, what else do you need? What are your longings? What do you need more? Then then people open up, and then this is a very, very strong thing because they're not used to that. They're
Mhm.
not used to having that.
I imagine even having some sense of, I don't know, responses right there when you say, what are your longings? Right? I don't know.
Mhm.
Right? As long
Yeah,
as there's peace or, I'm used to avoiding what I think or feel on the inside. I'm used to avoiding my longings. I'm used to it not bringing it forward. So, of course, if you ask me, yeah, I authentically probably don't know because I'm not used to checking into that or anyone really trying to bring it forward or having any sense of success, right?
yeah,
If I did try to bring it forward and feel like somebody cared.
right. So we listen carefully and we look for the emotional handle there. Like in your words, I could say you said in the end, like someone cared. I don't feel like someone, right? Did I hear that right? So we want to, wow,
Mhm.
that sounds interesting. It doesn't feel like anyone cares. Mhm. So, of course, you do that if it doesn't feel like anyone cares. Yeah.
Yeah, because it'd be hard. I imagine it'd be hard to continue to care about something, to have the knowledge of your caring when it feels like there's no hope to receive any care or have any success or any good outcome outside of you. That the resilient thing to do would be to tuck it away, right? Because otherwise, I have this need, this longing on the inside that has no hope for getting met. And if I had to sit with that all the time, that would probably bring up a lot of pain. But if, again, I don't have the template for success or any experiences for success bringing that up, then why sit in that pain and misery with no hope of anything being better or different? So, yeah, like learning to tuck it
Exactly.
away.
Exactly. And what you just did right now,
Mhm.
you were sharing a very important part of your emotional life. You just did that now, right?
Mhm.
Even just describing your strategy and why you don't want to do that. So we want to look at these tiny places where you do it here and now and just magnify that.
Mhm.
That was beautiful, the way you can explain what's going on for you and why you don't do that. It makes perfectly sense. perfect.
I'm imagining in stage one is probably really far ahead of where a withdrawer might be. You know, they might again give you more of that I don't know, or
Oh, you didn't say
what's the
match.
point? What's the point? You know, that's a lot of responses I get from withdrawers in stage one is what's the point?
Right.
And so if your withdrawer says to you, what's the point? That's a handle. So Tal, how would you explore that what's the point kind of response?
Hmm. Let's think about the context for what's the point,
Mhm.
right? I think maybe we want to help them picture the the scene that there is no point
Mhm.
to imagine, right? So I join them like, what's the point? She will never really be there for me. She will never really be interested in listening to me. Nobody can help me. I have to deal with my own stuff. I can't even imagine
Mhm.
that. I want to describe the thing that
Mhm.
you can't imagine.
Yeah. Or I don't want to burden
Right?
them by sharing what I
Right.
want. So again, I got to handle it myself. What's the point?
Right. So I joined them, but when I do that, I try to picture this image, right? Of seeding this image, seeding these like this attachment seeds of what I cannot even think is possible. And I start step by step. Yeah.
Mm.
This,
Really
I
beautiful.
think, withdrawers are not as tough as we might think. Yeah? Because if we just join them, if we don't fight their defenses, if we join them,
Yeah.
it's much easier to make them soften.
Mm. Yeah, that's a really good point. And I think, especially for therapists, and our role as a therapist in general is already a pursuing position, even if you are a natural withdrawer. But, a lot in EFT, we're always saying, like, run it through your own body, run it through your nervous system. And it feels easier if somebody's giving us a whole lot of stuff or wanting to talk, wanting to move forward, like being really putting stuff out there. It's like, oh, yeah, I can really feel that. But if somebody's kind of going the other direction, right, while saying, I want change, right, even us as a therapist can get stuck in our own heads. Well, if they want change, why don't they just open up their mouth and say something
Right.
and ask for it? It's like, well, duh, why didn't I think of that? If it was that easy, they would have been doing that and they wouldn't be there in session.
Definitely. So maybe
So,
we can do that now because you're right. If we do it from our own system, we understand them more and we can help our patient more if we connect to these places in us.
yeah. So embodying that context where going away or tucking away or the what's the point would make sense, even
Right.
making sense of that in our own nervous system.
Right. So if you're willing maybe to join, let's join
Yeah.
our audience. I'm doing that too
Mhm.
with
Yeah.
you. Just to stop for a moment and try to focus inside
Mhm.
and look at these places where we avoid
Mhm.
from our good reasons. What are the
Mhm.
things in our life
Mhm.
today that I avoid from
And
handling?
and I'm going to make a note for pursuers. All of us have had some kind of an experience somewhere where we felt like, what's the point of saying anything, of doing anything, of moving forward, of interjecting? Channel
De-
that experience. And if it
Definitely.
was only once, that part said, what's the point? Right?
Absolutely. So if we just don't use this title of withdrawers or pursuer, just think of us.
Mhm.
When in my life today, where do I do that? I avoid speaking about something because what's the point? Or nothing will change, or it's too embarrassing, or it's
Mhm.
whatever my good reasons are. I just want to take a moment and to grab that. And maybe then I can also be kind to myself and see what are the good reasons that I don't do that.
Mm.
What are the good reasons why I don't face this subject or emotion? And if I can imagine next, is it worth changing that? How much does this thing hurt? How much?
Mm.
Um, what is the cost for that? Yeah.
Mm.
And if it is worthwhile,
Mm. I'm
maybe
thinking
the
of the reward. If you've not had much reward, then you don't have anything to compare it to. All you see is costs. And
right,
even the
right.
idea of a reward doesn't seem worth the cost because it's a reward that's perhaps
Good,
never
good.
been
So that's a
felt.
good remark you're saying. So maybe we can imagine what it would look like if we will have this more processed. What
Yeah.
can we gain from that?
When you're saying, is it worth it?
Yeah.
That kind of the idea of putting yourself out there, making a comment where, you're wanting to avoid, you have to think about if I do, right? I'm kind of exposing myself, right? Opening myself up to be criticized, to be seen, to be rejected, and a lot of ouchy things could happen. And you have
Mhm.
to think, if I've never had any experience of success, no reward, of course, all I'm going to see is costs. And, for a therapist, maybe to sit and say, oh, but having a voice is so good and so healthy. It's like, well, that doesn't really feel like a reward that's worth the cost of putting myself out there and getting bitten, right?
Yeah. But I believe most of us have, even in every single time of our life, something that
Hmm.
we prefer to avoid.
Oh, yeah.
Yeah. And that's a good exercise to think about that and what would help us.
Mm.
So I don't know if you want to share, or I can share mine, or
Yeah. You're thinking what would help us feel comfortable or safe to bring our voice forward, to not avoid
well,
this.
first of all, what is this thing you avoid? What is this thing you avoid? And you use this strategy of
Mm.
avoiding for good reasons.
That's really good. I love how you're getting clear about what it is that we're actually avoiding. And on the surface level, I could imagine someone saying conflict, right? And I feel like that's kind of like the tip of the iceberg. It's like if I don't avoid, I have to put myself in there. I have to interject myself, and the perceived cost of interjecting and putting my feelings in the mix means possibly getting, having some conflict or something, so it's like the thing I'm avoiding is what happens if I put myself in there, whether and it's kind of two levels. If I interject myself, but even deeper than that, if I allow myself to care, then if I care, then I might have to say something or do something about that. And that means, again, like I might have to interject myself and put myself out there, be seen, be exposed, or set some things into motion that, again, might feel scary, may not feel like they'll go very well, may feel like they'll upset the apple cart in a big way. So again, it's just easier to not care, to just not even put myself out there.
Right.
And
Like if you think it will only bring a conflict that won't do any good, and you might be right about it, then what's the point? Let's avoid this conflict. Uh, Act like it's never there. Yeah, perfect sense, right? So I want us to be in contact with these places that we say, this is not a good place for me, but I avoid this conflict. I avoid it. And so for me, like when I had these couples, and I understood more that I want to help couples to speak about sex, because sex is one of the most common thing that people avoid talking about, right? There's so much shame around it and so much avoidance. And then I thought to myself, well, it's not like I do that so much in my personal life, right? Maybe I should go and try to do the job I asked them to do, right? And so I went to my therapy, and I was able to tell my therapist, okay, I've decided I need to do what I send my patients to do, and I'm going to speak more about my sex life. So I could do that, but that was uh, very hard to continue from there. And my therapist, she was very kind. She was very respective of my pace, and she wasn't pushing, and she was respecting. And actually, it didn't help me much because I needed more help there. I was avoiding this topic.
Mm.
So I could say, I want to speak about it more, but then I needed more help. So when someone is doing the effort to bring something that it is so hard for him to do, we want to give him the hand and, you know, help him more, even if it's about sex or about every other topic. We want to be focused to help them. This is the thing you want to work on. That's good. I want you to decide. I want you to bring things. I want you to be responsible for what's happening here. But I also help you not to avoid. Gently, with a lot of validation, with a lot of empathy. And I will show you this is the cycle, this is the avoidance. Let's think what we want to do here. But I'm going to help them not to do that. So that's one big thing I think is important to remember. Like, help your patients, okay?
Yeah. I feel like I can kind of hear some therapists saying, kind of getting stuck in this place of like feeling like they need to talk their clients into all the benefits of having a voice. And again, we know like the top down kind of thing doesn't work, right? And there's lots of self-help books and TikTok videos and stuff that'll already providing that, hey, just come forward, just do it. It's good to have a voice, all these reasons. So, we don't want to get stuck in like a sales pitch or feeling like we're having to drag them out, you know.
Absolutely not. It's not a top-down lectures. Yeah,
Right. We just want to embody that success, even in the little bits that they can come forward. And even as you said, like I need a little bit of help. I imagine how big that is even to say, hey, I want to have more of a voice here, and yet I need a little more help, you know. And
that
that's really cool that you could say that,
yeah.
you know.
And I want to, we don't have much time left. So I want to say another small thing, which is big, but just to mention that. So one part is helping one of the couple to share, to speak their story more, to learn more about what's in their inner life, what happens there, what they want and don't think that is possible, etc., etc. And the other part is that we want the other partner to be responsive. And if we have two withdrawers, then this is also something we can expect that won't be easy. Because if someone comes with a need or with a small step of heightening the emotion, we can expect that we'll see the block from the other side.
Mhm.
And so we want to validate that, and we want to come close to that, and we want to guide him. What does your heart feel? If you don't have to think about all the consequences and don't think so far, what does your heart feel right now when she's saying, that was nice to me? Yeah. So we need to work on when we do the enactment, we need to expect. This is also going to be a hard part to receive, and to not to receive, to respond. Sorry.
Mhm.
Yeah.
Mhm. And I'm imagining too, so as therapists are thinking stage two, And normally withdrawal re-engagement comes first, and you have two withdrawers.
Yeah.
Where do you start with two withdrawers in stage two?
So we start small steps, right? Small steps. One person can share something small. I like to have small enactments on small things, especially with withdrawer, and then to help the other side to respond. Mhm.
So,
Um,
because you have both are withdrawers, so would you just kind of ask who wants to go first, or how would you sort of decide if they're both withdrawers? Maybe like the person who's most likely to respond with empathy to a share, maybe would be the receiver.
yeah, well, I think if we're doing small steps of that in stage one, then
Hmm.
it's easier in stage two. Um, we can more easily feel like who's safer to go first. But from my experience, it's hard anyway. I will have blocks anyway. So
Hmm.
whoever is willing to go first, I will go with him. And I expect the block. Maybe I can give a small example for that from that same couple with that sex exercise. When she was saying to him, she said something nice. She said, you were touching me. You told me, I'm going to touch you here. I'm going to touch you there. Before you touched, you told me. And that was very nice. That's small, but they're not used to speak about that. So that's great. That's enough. I make an enactment. That's it. And you would think, what she said something nice. It shouldn't be hard to respond for that, right? She said, you did something nice. It made me feel relaxed. But what he hears is something different. And he goes, well, I'm not gonna be so careful and say every time where I'm gonna touch you. Boom. And that's a very small, nice enactment, right? So if we get used to do small enactments and we want to come close to him and we want to validate, okay, something happened for you there, right? And I can imagine he's I try to imagine, right? Because in the beginning I thought it would be easy for him to say thank you. But I try to imagine, no, I'm not going to say every time before I touch you, I'm going to touch you here, I'm going to touch you there. I can't be so sensitive all the time, right? That's a lot of pressure on you, right? So I can understand you're under a lot of pressure. And when you hear her saying, this was nice to me, you hear, be careful, be careful, be careful.
Hmm.
Keep being careful all the time, right?
Hmm.
I validate that. I bring more words to his defense and I
Hmm.
see why he needs that. And then I say, but right now, then I bring him back. Right now, when she appreciate what she did, because you are doing so much, you are bringing so much effort to be gentle with her.
Hmm.
How is it that she can tell you that was nice and calming? Thank you. How does your heart feel
Hmm.
right now? And then you can respond nicer.
I love
And
that.
and the second thing that happens there is that she can see the way I respond to him. She can hear the way I have compassion to his boom.
Mm-hmm.
And then she says, well, I'm so focused on my pain, on my body, why does it work, why it doesn't work, that I didn't pay attention of how much you're suffering there too. Yeah. So
Yeah.
it's a hard work.
Yeah. Well, I
It's
love
a,
what you're saying. And on, one part is modeling for the other partner, how you're responding. And the other, I think it's really big part of the pursuit of the working with withdrawer process is that when they start to experience success, there's this inherent sense of pressure that comes up on the inside, like, oh, I got to keep it up. I got to do this always. And now I start worrying about failing. Like, there's no way I can do this always all the time, right? And they kind of go away from the moment where their partner isn't necessarily saying, oh, you got to do this forever. They're trying to say, hey, here's something wonderful that you did. And so
Yeah.
we're trying to be with both of those parts, the one that wants to go away and think about that pressure to perform, and then help them come back to this moment where they're actually being seen for their efforts and their partner is showing appreciation, and help them just sit and take that in.
Yeah. That's actually, I think for me, these are the most, I'm so grateful for these moments when you can be a part in such a delicate, important conversation and help them do it differently. Um, this is so um, powerful when it happens. Yeah.
Yeah. It really sounds like the biggest takeaway from just our discussion, again, like, we could teach days on both the withdrawer pursuer position because there's so much to say. So, but in this little segment, it feels like the big takeaway is really to be able to sit with and be with and make sense of and validate this part that wants to go away, and the value of that protective strategy. Um, and, inviting that part, like working with that part, right? But first we have to join with it. We can't move forward or move anywhere with it if we don't first join with it, right? And so first
Yeah.
joining with it and connecting with them in a genuine kind of way, which can help make it safe for change, even if it's a tiptoe, right? To move forward, whatever pace, right? Just
Yeah.
using that acceptance, making it safe.
Yeah. And if it's two people that tend to do that, you need to help a little bit more in the beginning.
Mm-hmm.
And helping is also saying, take responsibility, please. What is the topic? Where it hurts? What do you want to work on? So it's in
Mm-hmm.
both ways.
Yeah, which is also still, a little paradoxical because it is counter to their way of surviving and protecting themselves, is to avoid being the one who takes the lead and brings stuff up.
Yeah.
Yeah. So this is beautiful, Tal. So this is wonderful. And again, like we could teach workshops, and I'm sure there will be some workshops coming out in the future about working with withdrawers, working with pursuers. So if folks want to find you, maybe they want to take a workshop with you or have you come to their community and teach a workshop, where can folks find you?
Yeah, I'd love that. You can email me or email our website, EFT Israel, but you can just email my mail. That's great. Um,
And
yeah.
what's your email address for people
Maybe
listening?
I'll send it, or it's Tal Padeh. You can find me on YouTube and
Mhm.
on ISEF website. Yeah.
Perfect. Because some folks will listen to this on podcast, so they may have to actually like just listen for your email and write it down. So Tal Padeh at like
So
Gmail.
yeah, tal.padeh@gmail.com. Yeah.
Okay, perfect. And so so if you guys are listening to this on podcast form, of course, in the title, I'm going to have Tal's name so you know how it's spelled. And in the description for this on YouTube, I will, of course, put a link to Tal's email and EFT Israel, your guys' website, eftisrael.com, or
Yeah.
perfect, perfect. And do you have any projects you're working on that do you like to share with everyone?
Nothing in particular. No,
Just
just
spreading the good word of EFT through Israel
yeah, and
and other
some
parts of the world.
exciting workshops here and a lot of work. So yeah.
Perfect. But you aren't just limited to Israel. If folks in other communities wanted to have you out, you definitely are open for that.
Right, I have. Yeah. Yeah, I have
Perfect.
things I
That'd be
teach in English.
wonderful.
Even
Awesome.
though it's not my first language, as you can hear, but
Oh,
EFT becomes my second language. So
Yeah. Well, you do it wonderfully, wonderfully, absolutely perfect. So we just appreciate you being with us today and sharing your wisdom for all the wonderful work that you do with the EFT Israel community and for the couples and therapists. So thank you so much for being with us.
Thank you very much for this opportunity and for all the good work you're doing, Annabelle. It's amazing.
Thank you. And thank you to all of our viewers. And, make sure that you keep sending me your ideas about more workshop ideas or podcast episodes you'd like me to do. And I have a running list going. So I always take in that feedback. And thank you, everyone. And if you haven't had a chance yet, make sure that you hit subscribe because more videos are on the way.